Hello, Patrick McKeown here. Thanks so much for supporting our Buteyko Clinic channel. Can I ask you a big favour? Would you mind subscribing? And with this, we can support the channel more, we can put out more videos, and it would really mean a lot. Buteyko, for me, has been life-changing and life-changing for the people that we're working with, and we would love to see it getting out there. So please subscribe. Thanks very much. The Buteyko technique, it was developed by a Ukrainian doctor back in the 1950s, and he made an observation. He was sitting with sick patients and he noticed that as the people got sicker, their breathing got worse. So they were breathing faster, they were breathing harder, they were caught for breath, and they were over-breathing. So he asked the question, was it their sickness that was causing them to breathe more air, or was it their poor breathing pattern, their faster, harder breathing, upper chest breathing, which was feeding into their sickness? So we started teaching them how to normalize their breathing volume, how to bring it down towards normal. This isn't just about slow breathing. This isn't just about low breathing. This is also, more importantly, is about breathing less air. And it's not about under breathing. It's recognizing that it's very common for people to have dysfunctional breathing, and the most common pattern of breathing with dysfunctional breathing is what's called chronic hyperventilation syndrome. So this means that the person is actually breathing too much air. Now, if you're breathing too much air, that has negative effects on the health of the body in so many different aspects of it. So, for example, the respiratory system, it can feed into asthma, mental health, sleep, exhaustion, and many organs and systems can be impacted by overbreathing or breathing too much air. So the Buteyko method is about normalizing your breathing volume. And the first step starts with breathing in and out through your nose, but also comes with that our little exercise to help decongest the nose. And you'll find them in our Buteyko Clinic channel. So they pretty much involve holding the breath to build up a moderate to strong air hunger, and that helps to open up the nose. And then the more you breathe through your nose, the better it works. The main exercise for adults with Buteyko is called breathe light or reduced volume breathing. And that simply involves taking a soft breath in through your nose, almost that your breathing in is imperceptible. So you're taking a very, very soft breath in, and you're really having a relaxed and a slow and a gentle breath out. And by doing that, you're going to take less air into your body. As you breathe less air into your body, the gas carbon dioxide being produced in the body doesn't leave the body so quickly, and as a result it accumulates in your lungs just a little, and when carbon dioxide accumulates in your lungs, it will accumulate in the blood leaving the lungs. Now, of course, carbon dioxide often has bad press as being this waste gas, but we have to bear in mind we actually produce this gas in the body. It's a byproduct of our metabolism, and we only breathe out about 15% of the gas we produce. So the goal is that we hold on to about 85% and we breathe out 15%. We only breathe out the excess, which is the 15%. But if we have a habit of breathing too hard and too fast, we can get rid of too much carbon dioxide. If we're getting rid of too much carbon dioxide from the lungs, we're also going to lower it in the blood leaving the lungs, and that's going to cause our blood vessels to narrow. So our entire blood circulation is impacted by the volume of air that we breathe. So with Buteyko, it's about breathing in and out through the nose, it's about breathing light, and it's about softening and under breathing for a period of time. So you know that you're doing the Buteyko exercise correctly when you feel air hunger. And the degree of air hunger or a feeling or sensation that you would like to take in a bigger breath, it should be tolerable. So it's looking for the sweet spot. Not too little, not too much, but just right. So it's a wonderful exercise to practice. And you know if it's inducing relaxation by how your body responds. But I can remember my first time ever practicing it, because it was very different to the typical breathing exercises that were out there. Very often people emphasize taking these slow, deep breaths. Genuinely, they had never did anything for me. In actual fact, it made me worse. I breathed slow, deep breaths going into an exam, and it took me about 10 minutes to get my head together. And when I talked about that on YouTube, people were kind of questioning, well, how could that be? But it's very obvious, because if you just focus on slowing down the respiratory rate, say, for example, you bring your respiratory rate down from 20 breaths per minute down to 10 breaths per minute. Okay, so you're making a significant reduction to your respiratory rate. But we also have to bear in mind, what is that going to do in the tidal volume? So as we reduce the respiratory rate, tidal volume is going to increase. Now the question to ask is, does the tidal volume increase disproportionately? And if it does, that's going to increase minute volume. And if it increases minute volume, we get rid of too much carbon dioxide, and the loss of carbon dioxide is going to reduce blood flow throughout the body because it causes blood vessels to constrict. It's going to reduce oxygen delivery throughout the body, including the heart and brain. It's going to increase blood pH, and that in turn increases neuronal excitability, so brain cells are firing more rapidly, and that can then feed into rumination of the mind and affect concentration, etc. So when we talk about the Buteyko method, it is about breathing nose, about breathing light, and about breathing slow, but it's about looking at your everyday breathing pattern. And it also has a measurement appraisal called a controlled pause, and that's simply the length of time that you can hold your breath for after an exhalation until the first reaction of your brain to breathe. So in other words, it's taking a normal breath in and out through your nose and pinching your nose and holding your breath and timing it in seconds. How long does it take for your brain to react to the fact that you've stopped breathing? And when you let go, you should have normal breathing. So your controlled pause, the objective is to get your controlled pause up to 40 seconds. Does everybody reach 40 seconds? No. But I would say that the first step that you look to get towards is 20 and 25 seconds, because a lot of people will have a controlled pause of about 10 seconds. If you have a controlled pause of 10 seconds, your breathing is likely to be faster, upper chest, you're feeling that you're not getting enough air, you feel that you can't take a deep breath, you have disproportionate breathlessness during physical exercise, you're more likely to be in an increased stress response, and you don't feel comfortable with your breathing. Okay, so this is where the Buteyko technique comes in. If you have asthma, I will genuinely say it is a wonderful technique, not just because I teach it, but I have seen the results over 23 years. People for anxiety, again, a wonderful technique because it's improving blood flow to the brain. It's helping to calm brain cell excitability. It's helping to increase oxygen delivery to the brain. And even during the breathe light exercise, whereby you are just softening and slowing down and breathing a little bit less air to feel that air hunger, we would expect blood flow to the brain to increase by between 5 and 10%. But also for mental health, it's a tremendous modality for sleep, improving your sleep quality. Whenever there is a mental health issue, or even if we're feeling highly stressed, our sleep is impacted. But if our sleep is impacted, we're more likely to be driven into highly stress. So you think about, having disrupted sleep and hyperarousal. Of course, that's going to be, is that the result of having mental health issues, or is it feeding back into the mental health issues? And there's a bidirectional feedback there. So I'm going to recommend the Buteyko technique. If you want to embark on a breathing method that's safe, that's accessible, that looks at your everyday breathing pattern, that improves your everyday breathing. And that's also a key point that I would like to make. There's a lot of breathing practices out there. Do they actually improve your underlying breathing? Do you feel better? In other words, when you put the exercise into practice, is it going to carry into the rest of your day and into the weeks and months? And do you then have a tool for life? Buteyko is a tool for life. It's not a breathing technique, really. It's about looking at your breathing patterns and helping you to bring your breathing to where it should be. It's about normalizing your breathing. There is nothing to add. It's about unlearning the habits that we have developed over the years, primarily due to stress, the pressures of everyday life, the sedentary lifestyle that we often have, the foods that we are eating, genetic predispositions, perfectionist tendencies, hormonal changes in females. There's so many factors that feed into having a poorer or less than optimal breathing pattern. But breathing is a function. It is so important. I would argue it's even more important than food, physical exercise, and meditation. And yes, our breathing can go wrong, but yes, we have control over it. And that's where the Buteyko technique comes in.